On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr. Dennis Dorf, a distinguished expert in the field of child and adolescent psychiatry. We're going to discuss a topic that affects families across the board: behavioral health issues in children. We'll explore the causes, the challenges, and the treatments, offering insight to help parents and caregivers support their children. Dr. Dorf, welcome to the show. I'm so glad you could make it today.
Thank you so much. Happy to be here.
So tell me a little bit about where did you grow up, where you're from, something about you.
Yeah, well, actually, I grew up a few blocks away from here. Grew up in Brooklyn my whole life. And I guess when it came time to choosing, a place to work at, to start my real first job, as they say, I wanted to be close to home.
So how did you decide to go into child and adolescent psychiatry?
Yeah, so actually, my path was a little atypical. I went to medical school in New York and always kind of knew I wanted to work with the pediatric population. Did a residency in pediatrics at SUNY Downstate Medical Center. Then I worked for a bit as a general pediatrician, but I just saw the big need for mental health providers and children and adolescents that were in needing those types of treatments and those types of providers. So I went back for training in psychiatry and child and adolescent psychiatry, and that's when I realized that that's what I kind of wanted to do and focus on.
So when I think about a psychiatrist, I always think of the stereotype, lay down on the couch, tell me all your problems, come here every week for the rest of your life. How is a child and adolescent psychiatrist different than the typical adult psychiatrist?
So that's an excellent question. What I love about the field of child and adolescent psychiatry is, you really work more with the family. It's not a one-man show, and it's not the quintessential, patient lying on the couch with just another doctor in the room talking about their feelings. It really is getting engagement from the parents, from the community, from the school, and really trying to hone in where the problem lies. And my favorite aspect, of course, being a pediatrician as well, is working with the pediatrician of that family or that patient or that family doctor that knows the patient really well. So I really like to take the collaborative approach.
So what are the common things that you see? You mentioned that there's an increasing need for mental health care specialists for children and adolescents. What are the common things that you're seeing today?
So one of the common things that we know that affects children and adolescents, possibly more so than even adults, are definitely conditions such as depression and anxiety. And the reason why we know they're more prevalent is because they present differently in kids. They don't look the same as they do in adults. So, a child struggling with depression or anxiety usually doesn't even have the same symptoms that an adult might walk into the office with. So oftentimes, those symptoms are missed. They look differently, children behave differently, but they're struggling, and no one really knows why or even how to pick up on those symptoms. So, that's where my job comes in. I work closely with the schools, with the PCP or the pediatrician of that patient, and really try to figure out, where did it start, where this episode, we call it, of abnormality occurred, and how to really just help the patient, figure out their journey, because for every child it's different.
So you talk about children being depressed. So are we talking about 2-year-olds? Are we talking about 10-year-olds? Are we talking about 15-year-olds? And how do you determine that they're depressed?
Yeah, so it's definitely not something you can do in one visit. So we always tell, a patient or a family that it takes several visits to really figure out what might be, what the child might be struggling with, what they might be, emotionally reacting to. Certainly, as you alluded to, infants can be depressed just as teenagers could be depressed. In infants or young toddlers, there might be feeding challenges, or there might be more of a reaction or an attachment issue to their caregiver. So that's really where the pediatrician or the psychiatrist comes in and tries to figure out where that bonding, is lacking. For young adults, even teenagers and young children, a lot of teens and young kids, they might be more irritable, they might be more angry. They're not necessarily crying all the time. They're not necessarily stating the words, "I'm sad." A lot of times, kids might be struggling in school or not wanting to interact with their friends as they used to. So that's kind of the things that we look at. Their environment, where they're falling behind the cracks, as we would say, whether it be in the home or the school, and trying to figure out, what made you irritable, and why is it affecting you for a prolonged amount of time.
So this is a huge job. You're talking about 4-year-olds who might be depressed, and it sounds like it's very, very subtle. Irritable. I mean, when do you determine when a child is irritable and it's normal? I mean, I'm irritable. Yeah. Everybody's irritable. When do you determine this is a normal part of growing up and when they need to see a psychiatrist?
Yeah, I mean, I'm glad you asked that. As we know, whether it be parents or, providers, everyone gets sad, everyone gets angry. It's a part of life. Anxiety is normal. That's a survival instinct, and those are normal stress responses. But when a child is irritable for too long, when they're having temper tantrums more often than not, when you recognize that there's something even in your family history that can explain why the child is behaving this way, then you probably should seek an expert opinion. And figure out, is there anything that the parent who knows the child best isn't thinking of, or possibly hasn't even come to the conclusion to, that could be contributing to the child's irritability. So yes, development, that's definitely something that we focus on. Struggling through mood episodes and tantrums and emotional challenges, that's a part of life. But when it's overtaking someone's life for a prolonged amount of time, whether it be 2 weeks or 1 month, many months, then a conversation should happen with the child's provider who knows them best.
So when you mention family history, I always am reminded that we are, unfortunately, products of our genetics, right? So if there's a psychiatric history in the family, does that put children at higher risk for mental health issues?
It can, not always. As we know, it's that huge debate, nurture versus genetics. We know that depression and anxiety doesn't discriminate against socioeconomic statuses. Kids from all backgrounds and adults as well can, experience, situations where they're just not acting like they used to act. They're not wanting to be around other people, or they're struggling with attention issues or learning issues, whether it be in young adulthood or elementary school. So that's when we ask, well, anything in the family, your parents, your grandparents, cousins, aunts, uncles, anything that they struggled with that were similar. And many of the times, if that answer is known, something that could have helped a family member might be the right answer for the child as well.
There's such a huge stigma about going to see a psychiatrist, assuming you can find one, because as you mentioned, we don't have enough mental health providers in this country, be it social workers, psychologists, psychiatrists, and certainly child and adolescent psychiatrists are even rarer, I think. Let's start with the obvious question. Why is there such a stigma about asking for help in our society?
That is a very interesting question and a very important question. I think it just, it leads to the pathos of being uncomfortable with asking for help in general. You see that with patients with diabetes. A lot of people don't necessarily want to admit that they're sick. And I think hopefully this country is moving more toward a scenery of where we're asking for how to get healthier, not necessarily focusing on the sick person. So I think that's where community engagement comes in. I think it's about, realizing how you can embed yourself, whether it be your school or your community, and talking about it with your doctor, and just realizing that, not labeling someone as sick, but just labeling someone as, you're a healthy individual, but this is what you're struggling with. And with mental health, it's more difficult because, as you had said earlier, sometimes those signs are subtle and people can brush it off easily.
I remember the American Academy of Pediatrics had a tagline that said, emotional health needs checkups too,
Right.
or emotions need, I think it was emotions need checkups too. Is this part of what pediatricians should be dealing with, family medicine physicians, when they're seeing children and adolescents? Would you recommend that everybody be screened for depression and anxiety?
Absolutely. I think the primary care physician, the pediatrician, even the OBGYN who knows the patient very, very well, they usually know more than the psychiatrist does at the first visit, about the family history, the patient's past. If they notice something is aloof or something is just, doesn't look right, that's when they can make the referral, or that's when they can make the screening. Because usually the patient does feel more comfortable, discussing those issues with their primary care provider and having that trust and rapport. And if they feel comfortable hearing it from their doctor that they've known for many, many years, that, something just isn't right about your situation at this time, you're struggling, it'd be a good time to talk to a therapist or a psychiatrist, someone that can really take their time and, go through what you're struggling with.
So you mentioned OBGYNs. That's really talking about the maternal depression, right?
Yeah.
After giving birth. And that's a whole
Oh, yeah.
segment that we've got to do another 26 minutes on.
Absolutely.
But specifically about children and adolescents, you mentioned depression, anxiety. That's part of good pediatric care. Is that what I'm hearing?
Absolutely. But anytime, a pediatrician or a primary care provider just doesn't feel comfortable assessing for depression that maybe they're not used to seeing. There's that common misconception that every kid is sad or every kid is not eating, if they're depressed. That's not necessarily true. The kid might be angry, the kid might be overeating, the kid might be behaving in ways they've never behaved in before. And that's when it's time to really do that exploratory nature and get to the root cause, which sometimes you may not get at the first visit or even the second visit.
So overeating, undereating, being sad, being withdrawn, sleeping too much, not sleeping enough.
Yeah.
Sounds like everybody needs to be screened.
Well, it's usually, it comes with the territory of, is it affecting someone's life? If the patient is definitely faltering in school or faltering at home, and if the parent notices that this has become a pattern that's maladaptive, as you mentioned, those are all parts of human nature and behavior and a part of life. But if their grades are suffering, if they're not communicating the way they used to, if all of a sudden they're anxious to go outside and they've never had that happen to them before, it's time to really explore the causes about that.
So we've heard a lot about the mental health crisis in this country. Is it that kids are having more stressors? I know adults have had more stressors since the pandemic, but I can't really blame the pandemic. Is it that kids are more likely to be depressed and anxious, or is it we're noticing it more often?
I think it's a little bit of both. I think, as we mentioned before, we're definitely moving on the right track in recognizing mental health as a huge concern. It really is a crisis in the United States today and around the world. I think certainly there are certain aspects of a child's life today that certainly I didn't grow up with, and maybe you didn't grow up with. Kids certainly are more stressed, whether it's more of a motivation to succeed or the peer pressures are there that weren't there before. I won't get into it too much, but for example, social media has a huge role on a child's well-being and self-esteem and how they view themselves and the rest of the world. So those constant algorithms that are feeding kids, necessarily information or imagery that others didn't have access to, 20 or 50 years ago. It's certainly alarming, and it's changing the way the brain is actually wired at an early age. So we know that developmentally kids are more stressed. We know that mental health is being talked about more, which is great. But sometimes, parents may not feel comfortable, asking those questions. Or even primary care providers might not know how to ask those difficult questions. So I think it's great that, at this hospital and other hospitals and other clinics, it's about a team effort, working with the primary care provider, the school counselor, establishing that relationship early on to benefit the child and the family.
I think that's the third time you've said the word school.
Yes.
And we've got to talk about school, because that's, the way you and I work, kids work in school. Let's talk about learning problems. When kids are having learning problems, ADD, attention deficit disorder, ADHD, attention deficit hyperactivity disorder, all kinds of issues in school. Is that something that a child and adolescent psychiatrist would be involved in?
Absolutely. We know that, usually ADHD and ADD classically is diagnosed before the age of 12, but many kids who have ADHD don't necessarily appear or have the same symptoms as another kid. There's that common misconception that it's the hyper rambunctious kid who'll have those symptoms. But it could also be the really quiet, timid kid who's spacing out all day, as they call it, or daydreaming. And no one would ever think that the kid is struggling, but that's because they don't know they're struggling and they don't ask for help. And it's a neurodevelopmental condition where they have processing issues. And many times, it won't be picked up on. With autism, autism usually appears earlier than ADHD. But what we've noticed as child psychiatrists is that, many kids with autism will have ADHD, but not everybody with ADHD has autism.
So you could actually have more than one diagnosis.
Yes.
Wow, that must make it much more difficult to treat.
It can be. And that's where we really rely on, the school to give us as much information as we can, whether it be through conversations or, different forms that the teachers fill out or counselors. As you had mentioned, kids spend the majority of their life in school from K through 12. So who would better know their child's trajectory than the teacher, as well as the parent, of course. So, whether the child is impulsive or hyperactive or inattentive, that could be a sign of a learning disorder or ADHD. A child doesn't want to communicate with someone. They're very overly anxious. They have sensory issues. They don't necessarily, talk or respond a certain way as the other kids in the class do. That could be autism. It could be a little bit of both. And the treatments sometimes do differ as well. So what I also always like to tell families is that, they think of psychiatry as, doctors who just give medicine. And that's not true. A lot of my work and a lot of what other child psychiatrists do are therapeutic approaches, working with the schools and the parents to find out what behavioral techniques the child can benefit from, and also referring to a specialized therapist when needed. To really work through those problems on a weekly basis.
So that's very interesting. So just because your child is struggling and has a diagnosis, the treatment isn't always medication.
Right.
So what other kinds of modalities are there? You said there's therapists. Is that talk therapy or say more?
Absolutely, yeah. Honestly, and I've come across such brilliant people who do amazing therapeutic modalities. It could be anyone the child trusts who feels comfortable with in whatever their degree and certification is, whether that be a licensed social worker, a psychologist, a special autism related therapist. Anyone the child really connects with and has a good rapport with and can go through those different training modules with, whether that be autism-specific therapy, ADHD management therapy, some of which that I do as well. But sometimes parents like to refer their children or have a therapist just for this technique versus, talk therapy with this person. Have the psychiatrist manage the medications or have the psychiatrist do all of the above. So I think every individual family and situation is different.
That's really interesting. It sounds like you're working with the families, you're working with the school, you're working with the child's, everything around the child, but it also sounds like everybody has choices here.
Absolutely.
Which I did not recognize. I didn't realize that. So when a child is struggling, let's say in school, or a family is saying, I just can't stand the behavior, can families make an appointment directly to you, or should they be speaking to their pediatrician? Should they be talking to school counselors? How do you get a child and adolescent psychiatrist appointment?
Yeah, I guess it depends on which setting you work with, and as was mentioned earlier, there's not that many of us out there, so it's really just figuring out what resources are available to you in your community. But we know that here in Brooklyn, usually talking to your primary care provider or your pediatrician should be your first stop, because they would know the process and how to, whether to refer to a therapist first or a psychiatrist, and many times it could be at the same visit, referrals to both. And then those leaders of the mental health clinic would delegate those appointments and really help the child figure out, should they see the therapist first for an assessment? Many times that is the case. Gathering all the information and all the forms from a teacher, from the parents, so that way when they come to the psychiatrist's office, they have all the information there to make a well-crafted diagnosis and opinion.
This sure sounds very time consuming. It sounds like there's a lot going on behind the scenes,
Sure,
as opposed to what's happening in your office. How do families navigate this system? Can you give us some hints of how do parents just hang in there? This sounds very complicated.
Yeah, well, certainly just keeping a list of everyone's name and almost having your own directory of where to figure out who's seen where the appointments are, and just I think that a lot of that falls on the providers as well, having a good support staff on reminding patients, this is your appointment with the therapist, this is the appointment with the psychiatrist, but make sure you do see your pediatrician, who will help, remind the families that, don't forget about your upcoming appointment with this specialist, to really hone in on all of those, all of those tasks and, treatments that the team is waiting for to help the child.
What about those kids who really need something special, whether it's special education, whether it's, I think you mentioned some children need certain modifications in school or something, if they're autistic, autism spectrum disorder, if they're on the spectrum. Is that something that you work directly with the school, or is that the family needs to? It just sounds very complicated.
Yeah. I mean, thankfully here at South Brooklyn Health, I know that we have a great team, of social workers, of therapists, psychologists, psychiatrists, who really can connect with the school if needed to figure out, why is the student falling behind. They might not have anything wrong with their intelligence, nor they might not have ADHD or autism. It could just be a learning disorder. They could just need, some extra tutoring. And that really, really, would be a great connection to have between the parent and the guidance counselor and the teacher, and just opening up that pathway of communications. An IEP or a 504, those are special plans.
And what's an IEP and a 504?
Yeah, so that's an individualized educational plan that many children who need those extra support services, such as special education services, that kids might qualify for if they are struggling. If a kid needs medication in the school during the day to help them learn, that would fall under the 504. So those are all kind of technical terms, but usually the school would be your first step to requesting on how to get evaluated, to figure out how the school can do their part to provide those services, whether it's a smaller class size, or being pulled out of class a few times a day to speak with the counselor about a child's anxious feelings. So we really do work closely with the school to really make sure that the child can succeed.
Come a long way from depression, anxiety, autism. This is huge, and it's almost overwhelming. But I can't end a segment on mental health without talking about the number of teenagers who unfortunately, and the growing number of teenagers in this country who are depressed, who are anxious, and unfortunately commit suicide.
Yeah.
Can you, in case there's somebody out there who is thinking about suicide, in case there's a teenager out there who's depressed and needs help, what are the resources? What should they do?
Absolutely. There has been a national push for the new 3-digit number 988. So certainly if there is someone that is struggling and the teenager doesn't feel comfortable calling 911 or telling anyone, they can always use that service. But certainly if any parent has any questions or is concerned about their child, or any parent or teacher is concerned that the child is just struggling and just saying things or acting things in a way that is not uniform to their old self, bringing them to the emergency room probably is the next best step, especially if they're having suicidal thoughts or self-harm behaviors.
So 988, a life-saving telephone number that everybody should know about. I want to thank you so much for the information, and there's no question in my mind we have saved some lives.
Thank you. Thank you, Dr. Siegel. Appreciate it.
Thank you. And that brings us to the end of our program today. We thank you for tuning in and learning alongside of us. For more information about our show, call 718-510-2103 or visit www.zormed.com. Stay updated and engaged with South Brooklyn Health by visiting us online or see the URL on the screen. This broadcast was brought to you by Brick Media in partnership with South Brooklyn Health.